In the parking lot of a church on Maryland's Eastern Shore, a mobile treatment unit waits quietly, offering what so many need but too few can access in the United States: care for substance use and mental health. The heart of this work is not a doctor or a nurse, but a peer, someone who has faced the same struggles, learned to cope, and is now trained to guide others along the way. Peers have the potential to fill the enormous treatment gaps in America's behavioral health system. Only 1 in 5 people with substance use challenges receives care, and the numbers are even lower in rural regions. Fewer still gain access to medications for opioid addiction, leaving them vulnerable to relapse, overdose, and repeated visits to overburdened hospitals. Expanding peer-delivered care may be one of the most practical ways forward, and Global Health provides valuable lessons on how to make this work. For decades, researchers and practitioners working in low-resource settings have pioneered strategies for scaling care despite shortages of specialists. One key model is task shifting, where non-specialists are trained and supported to deliver essential interventions traditionally reserved for doctors or psychologists. This model transformed HIV treatment in Africa, allowing life-saving medications to reach millions. Similar approaches can help address the U.S. addiction crisis. In South Africa, programs like Khanya have shown the power of peers. Developed through years of collaboration with patients and communities, Khanya trains people with lived experience of HIV and substance use to support others. The program improved adherence to HIV treatment and reduced harmful drinking for some participants. Crucially, patients expressed a preference for care from peers, saying they felt understood and respected in ways that traditional systems often failed to provide. These lessons are now being applied in American cities and towns. In Baltimore and Washington, peers are helping patients stay engaged with both HIV and opioid treatments. In rural Maryland, the model extends to RVs stationed outside churches, providing quiet but vital spaces for healing. Patients who meet with peers often find new motivation, encouraged by someone who has walked the same road. The Biden administration has emphasized the importance of expanding recovery support services, and scaling peer interventions could be central to that mission. But meaningful investment and long-term collaboration are needed. Just as American science has benefited from innovations abroad, behavioral healthcare can draw strength from global partnerships. Addiction and mental health struggles look different across cultures, but one truth is universal: healing often begins with trust. By supporting a peer workforce and valuing their lived experience, the U.S. has an opportunity to close gaps in care and offer recovery rooted in compassion and connection.